I'm Dr. Emmanuel Kiza-Masiga. I'm the head of the Adult Psychiatric Unit at Nakasero Hospital Limited, and I'm here to tell you about mental health. Importantly, this year's World Mental Health Day theme is mental health as a human right, and probably this is where we should begin. All patients with poor mental health or mental illnesses have a right to good health care. We're happy that Nakasero Hospital understands this clearly. That's why they have provided a unit for mental health care, one of the few private units in Uganda actually, and probably in East Africa. So it's a human right for people with mental illnesses to get care that is timely. It should be adequate, not that they are getting substandard care because they have mental illnesses. And I'm glad that we are promoting this because here, as I said, I can assure you, you will not be treated any differently because of your mental illness. We will respect your human rights. We will ensure that you receive the best care that you deserve. And again, I would like to thank Nakasero Hospital for providing us the space to be able to look after the human rights of people with mental illnesses. The importance of mental health. Well, I think it's very difficult to summarize mental health, but always when I always tell people that mental health is functioning. If you find that you are not meeting your needs as a human being, you should always consider your mental health, okay? And whether it's not sleeping well, whether it's not working well at work, whether there are issues at home, you should always consider your mental health. So at Nakasero Hospital, we have a dedicated team. There are 4 psychiatrists, 2 clinical psychologists. We also have social workers, and we also have many psychiatric nurses. Ideally, we're an inpatient unit that deals primarily with severe mental illness as inpatient, but outpatient we deal with all types of everyday mental health challenges. So you could think about stress at work, stress at home, challenges at school. If you have children and they're not meeting their potential, these are the things we deal with on a day-to-day basis. As I said from the beginning, our key role is to make you functional. And our key role is not to tell you how to function. And that's the key thing about mental health, is that you come in and say, hi doc, I'm person X and I feel I'm struggling with this. And it's our job to try and, 1, make sure that you have a genuine need of that struggle, and then 2, to find different ways to manage that need. So we are one of the few inpatient units in the country. Many people will know that there's a lot of stigma to mental health, and beds for inpatient care for people with mental illnesses are shrinking. But we are happy that Nakasero Hospital has given us a space where we can admit at least 10 patients. We have about 10 beds for purely psychiatric services, and other beds in the hospital are also available for us if we need them. There are probably not more than 5 inpatient psychiatric units in the country, private owned, and that's why it's very important to prevent it. And there's always this thing that you can't prevent it, and maybe that's not true. I think there are many things we can do to promote our mental health: exercise, socializing, going to religious activities, eating well, being with friends and family. All those things are important for our mental health. So we at Nakasero Hospital don't really want you to be unwell. When you come in, we help you realize these things. Interestingly, mental disorders are the most disabling worldwide. People don't really think too much about them because there's not a lot of death associated with it, but there's a lot of disability. Just imagine being there and you're not working, you're not enjoying relationships, you know. It's really disabling, and it can be a burden to people around you. So let's be aware of mental health and its challenges. Early warning signs, I could go on and on, but I don't feel that's the best way to do it. I think the best way to do it is if you as an individual feel that you're not meeting your function as you would like, then come in and we have a chat. Importance of seeking help. I can't emphasize this enough. It's very interesting that people come in so late for mental health services. They come in even later than cancer. And many times this causes challenges because it becomes harder to manage, but I would encourage you to come in a bit earlier. Supportive communities, yes we do. We collaborate with many organizations around. At least I sit on the board of some of those organizations like Heart to Heart Spaces, where we give you, just a space to have a chat about your mental health and things like that. We do deal with diverse populations. I want you to be sure that you will not be treated differently because you're different in Nakasero Hospital. There is a belief that people with mental health are treated differently, but it doesn't matter whether you're Muslim, Christian, whichever tribe, you will be managed fairly and you will get well better. And hopefully in future, in the new structure that's about to be opened, we will have the ability to move forward. Our plan is we want to move into different fields, specialty fields in psychiatry. So we want to open a child and adolescent mental health unit, we want to open an old age mental health unit, we want to open a mood disorder clinic, we want to open a psychosis clinic, we want to open a maternal health unit, maternal mental health unit. We want to open a consultation liaison unit specific. Right now we do it, but we do it under the same unit, but now we want to have specific divisions.